For the past 18 months, one topic has been on all of our radars: healthcare. But what does healthcare mean in the LGBTQIA+ community, specifically here in Philadelphia? Today on QT, Queer Health. Stay with us. Hello and welcome to QT Queer Temple, the show in which we explore the world through the lens of LGBTQIA+ individuals. Over the past months, we have seen many shows, including ours, that reported on how people are dealing with the effects of the COVID-19 pandemic. But COVID-19 isn't the only aspect of healthcare up for debate. First up, reproductive justice. When folks think about Planned Parenthood, they probably think about their services, the services they offer regarding reproductive health care. Yet Planned Parenthood is doing so much more, specifically when it comes to advocacy work. I sat down for a conversation with Janielle Bryan, a Temple graduate and reproductive justice advocate. Please check her out. So welcome, Janielle. Thank you so much for coming today, or Zooming today.
Sure, thanks for having me.
Would you please first introduce yourself?
Sure, my name is Janielle Bryan. I am a Temple alumni. I did my undergrad at Temple. Yes, and then did my master's at Drexel, so Philly made through and through. I am currently working at the health department in the COVID department as a policy coordinator, but my background is in sex ed as a sexual health educator.
Great. This specific episode is about the larger topic of health, and the reason why you are here today is to speak about Planned Parenthood, because you are affiliated somehow with Planned Parenthood Health.
Sure, yeah. So my first job out of undergrad was doing research. It was a research project in conjunction with Planned Parenthood and NYU's Department of Public Health. They were doing a study and they were looking at birth control and why, even though we have all these options, people are still getting pregnant, and they're trying to figure out why. And that was my first intro really into sexual health, reproductive health. But that's like my first endeavor into public health right out of undergrad. And yeah, we found that even though we have all these options and people have Planned Parenthood where they can get these options, doctors or the medical system is not spending as much time as one would need to make such a hard decision because there's so many options and everybody is different. They realize that, doctors need to spend more time with their patients and talk to them longer so people can make an informed decision instead of just, pushing everyone in the pill, and that might not work for you or your lifestyle or your circumstance.
That's really interesting and important to note that usually, the first assumption is the pill, that when you talk about birth control. Why were you specifically drawn to Planned Parenthood, or why did you go to Planned Parenthood instead of any other reproductive healthcare organization?
Right. So Planned Parenthood, when I think of reproductive health, I think of Planned Parenthood, and so many people do as well. So if we're going to talk about reproductive health, let's go to the source. Let's go to a trusted source where a lot of people go, and that is well respected, has done great work, and that is readily available in most neighborhoods, especially here in Philadelphia.
Yeah, they are right in, and please correct me if I'm wrong, they're on Chestnut or Walnut, right?
Yes, they're right downtown. So I was at that one. I was at the one at 69th Street, which is in West Philly, where West Philly and Delaware County meets. There's one in Westchester. There's Planned Parenthoods all over the place.
And we're talking about reproductive healthcare the entire time. What is reproductive healthcare for our viewers?
So like reproductive health and reproductive justice, it's not just physical. It is the complete physical, mental, spiritual, political, social, economic well-being of folks, of, I don't want to say women or girls, just folks, people, and their community.
And when we talk about reproductive health care, we talked about the pill. Another thing that that Planned Parenthood is also, and please correct me there if I'm wrong, is Planned Parenthood offering or guiding you to abortion centers if you want to?
Sure. So not all Planned Parenthoods do it, perform abortions on site. The one at Locust Street does, so the one in Center City. And if they can't do it there, they'll, send you to another Planned Parenthood, or there's other places in the city of Philadelphia that perform abortions, and some people have high risk abortions, so they have to go to certain places. So I feel like Planned Parenthood is a great first step to find a place that is best for you. Even working in public health, and it was years after I worked with Planned Parenthood in the job I told you about. I was at Penn for a completely different reason, and I found out that Penn, with the University of Pennsylvania in West Philadelphia, they do high risk abortions, which I didn't know because they don't widely broadcast that. You'd only know they do it there if you were referred from another provider.
Okay. Can you explain what a high risk abortion is?
Sure. So high risk abortion is an abortion that, if performed, or, to be performed and considered high risk, it is threatening the life of, the mother or the person carrying the child.
Okay. And I think while this is an important part of Planned Parenthood, we still often just associate the performing abortions with Planned Parenthood, but Planned Parenthood is so much more.
Yes.
When we talk about education, for example, what is Planned Parenthood doing in terms of sexual education?
Sure. Planned Parenthood does a lot with educating the public about sexual health. So I know in some instances, Planned Parenthood has their own sexual health educators that go into colleges, universities, sometimes schools. A lot of times their education, which I really like, is like on the ground. So if there's a community event, they will table. So even if people are there for another reason, they still have that presence there. And just their presence being there is so important for the community to know that they have this resource, but they're also educating as well.
Okay. And I know we are almost running out of time, but one last question that is really important for me is, this is a show about LGBTQIA plus identities. How would you say Planned Parenthood is working for the LGBTQIA plus community?
Sure. This is something that is very important to me and to Planned Parenthood from the work that they're doing. They have made it explicitly clear that they're here for, the community through the work that they're doing and the services that they offer. So one particular thing that they're doing is kind of changing the language around reproductive health, which is something that I think is so important because words mean things. Words have power. So not, just women's health, it's reproductive health, because not everyone who reproduces identifies as a woman. So that is very important, and having providers and staff that are inclusive and that are affirming and culturally competent, because like providing care is great, but also, do you feel comfortable talking to your provider, talking to your doctor? You can't fully open up with someone that you do not feel comfortable with. And Planned Parenthood has been providing a lot of high care quality services to this community and focusing on their needs and their wants. They've been doing a lot of outreach to the LGBTQIA community and asking them, like, how can we better serve you? I know certain locations, including the one on Locust Street, the main one, and I believe the one in Westchester as well, also do hormone therapy to the point that there's now a wait list. And they're doing it through telecare, I think telehealth, sorry. And then you come in afterwards. But also adding telehealth is important in a time where we're dealing with a pandemic that, while it's slowing down, is still here. A lot of folks do not feel comfortable. I don't have the access to come into offices like they used to. So being able to still access care and get the health that you need from your home is also very important.
Thank you so much, Janelle.
Sure.
It's been a pleasure to talk to you, and I really appreciate the time you took to talk to me today.
Sure. Thank you so much for having me. This was a great conversation.
The past year has certainly been difficult for a lot of you out there. I know I said that before, but know that QT is more than just a TV show. It is your show, and we are here for you. Please reach out to us if you need any help or support. You can find us and other amazing queer resources on our Instagram at QueerTemple. For some people, dealing with anxieties and difficult lives may result in coping mechanisms that may harm them in the long run. The National Institute on Drug Abuse reports that, quote, data from 2018 suggests that substance use patterns reported by sexual minorities adults are higher compared to those reported by heterosexual adults. The Philadelphia chapter of the AIDS Coalition to Unleash Power, short ACT UP, started Prevention Point Philadelphia in 1991. These services range from syringe exchange to HIV testing and treatment. I sat down for a conversation with one of their case managers, Tiffany Rodriguez. Now, but before we go into the interview, I want you to understand the difference between PEP and PrEP because we will be talking about the two medications. PEP stands for post-exposure prophylaxis and may prevent infection with HIV if taken timely after potential exposure. PrEP, on the other hand, stands for pre-exposure prophylaxis and can function as a medication that prevents HIV when taken on a daily basis. For further information, visit the website of ACT UP or Prevention Point. And now on to the interview. Thank you very much for coming today, Tiff, and welcome to QT. Would you first please start with a general? Introduce yourself, your pronouns, and what is your affiliation with Temple?
Sure. So my name is Tiff Rodriguez. My pronouns are she, they. I'm a medical case manager at Prevention Point Philadelphia. I'm a Temple alum. I graduated in 2020 from the College of Public Health with my undergrad. And I'm a current student right now at Temple in grad school, double major for my master's in public health and in public policy.
Double major? That's wow, kudos. You said you work at Prevention Point. Now, I know what it is, but please tell our viewers, what is Prevention Point?
Yeah, so Prevention Point, in a nutshell, is a syringe exchange program, but we are very harm reduction based and provide public health services and social services to people in Kensington, but very open to anyone who drops by our location. Yeah, that's pretty much that.
Cool. What would you say is Prevention Point's mission when it comes to HIV prevention and treatment?
Yeah, so Prevention Point was basically founded with the focus of HIV prevention. Right now, I would say like our main focus is prevention in and of itself. I mean, it's in our name, not just with trying to prevent the spread and new diagnoses of HIV, but also trying to prevent HIV deaths in a very, very vulnerable population.
Mm-hmm. And the population that you serve, you said you were in Kensington. What kind of people come to Prevention Point?
Yeah, so Prevention Point, we will take anyone that walks through our doors, but we primarily give services to folks who are experiencing homelessness and who are in their active drug addiction.
And how can people who are actively using drugs, how do they usually get HIV, or why are they at higher risk at, let's say, another person who is not using drugs, for example?
Yeah. So typically when folks are using drugs, they might pull for resources. So resources being actual drugs or maybe supplies that they're using in order to consume their drugs. So things like syringes, cookers, tourniquets, etc. So when we have that kind of blood to blood transaction, it puts folks at a very vulnerable state and a very high risk for HIV. On top of that, we do have plenty of folks in the area who engage in sex work. So it's one way in order just to survive, and in order to supply yourself with money that you're going to need in order to get well and supply yourself with your drugs. So that also puts folks at a very high risk.
Yeah, thanks for pointing that out. And I guess if you are now a person who is at high risk, what can Prevention Point do to prevent the spread of HIV? What exactly are you doing?
We're doing everything under the sun. So not only do we give out safer sex supplies like dental dams, internal condoms, external condoms, lubricant, and sexual health education, but we also do provide testing services. It's rapid testing. We also provide PrEP services. And if you are someone who might be living with HIV, and maybe want to prevent the spread, I mean, we will definitely educate you on that, and have 2 HIV providers at our Kensington location.
Okay. And I think you said that we at Prevention Point, you're trying to, if someone is HIV positive, you're trying to make it so they don't spread the HIV. Can we talk about U equals U?
Yes, we absolutely can.
Nice,
So our goal for everyone is to get folks to an undetectable level. So when you're HIV, the way I explain it to folks, because I'm a very visual learner, and a lot of folks have very low health literacy or might not understand what HIV is and how it works. So the way I kind of explain it to folks is if you have 2 glasses of water and one is half bleach, half water, and one has just a drop of bleach, and you dip 2 black socks in each one, and you see one kind of gets damaged and one might not. So I would, the water is kind of like our blood supply, and the bleach can be considered like a viral load, like an HIV viral load. So I explain to folks, when your viral load is down, you can reduce the spread onto other people, onto whatever. So that's kind of the way that I explain it to folks. Our goal is to have everyone at an undetectable level, but there are challenges with medication adherence even. So folks do have the option to get their medication delivered to Prevention Point. If they pick up their medication every month, then they'll receive a $25 gift card just for getting their medication. We also have a phlebotomist on site now, which is really nice. So we don't have to kind of convince folks like, get well, hopefully come back, and we can try to drive you to LabCorp and hopefully get a stick and not a terrible experience. So now that we have, our own team, and we're really, in the beginning stages of building our own clinic, and everyone is harm reduction based, and folks are not going to feel, pressure and stigma, or have a terrible experience with just trying to get a simple blood draw. And that's something that can really keep people from being adherent to their meds. I mean, we need to see where your results are at to even prescribe you medication. So that's kind of, what we're doing is just building our own team, because it's very, very hard to find harm reduction friendly resources in the area for people.
Big shout out to Miss Terry.
I love Miss Terry. Yeah. Big shout out to Miss Terry.
I guess, so since this is QT Queer Temple, how would you say, do you see, specifically you as a case manager, do you see people of the LGBTQIA plus community specifically vulnerable to HIV?
Yeah, absolutely. So we know just on research alone that folks in the LGBTQ plus community typically will use substances at a higher rate than the quote unquote general population, and that leaves folks at a very vulnerable state. We also know that folks in the LGBTQ plus community are at higher risk for homelessness. So that's like right in our nation, right in our neck of the woods at Prevention Point. We kind of have a joke with staff, because there are so many queer identifying folks at Prevention Point that, you're not hired unless you're gay. which is like the funniest thing ever. We just hosted, I actually co-coordinated our very first Pride event recently. It was a great time, but I would say that like what Prevention Point is doing, it's the very, very basic thing that I think people have been calling for a lot lately, and we've kind of been on the ball for. It's just, hiring people from the communities that you are trying to serve. No one is going to understand that lived experience unless they have that same experience. So I think, as someone coming in and being greeted by maybe a trans woman at the door, and then getting linked up to a tester who's like very, feminine identifying, and then getting hooked up with the case manager who's also like very gay. So it just feels very welcoming. It feels very comforting for a lot of folks in the LGBT community. Certain things, people might not have to explain. It's an understanding between us. And I think, not always having to re-explain yourself and re-explain who you are, re-explain your situation, and constantly having to reinstate your pronouns. And that's, when you're in a battle with trying to manage your HIV care, the last thing you want to battle with is your orientation all over again.
Yeah.
Because it feels pretty crappy. I think Prevention Point has also been doing a great job in just honoring the fact that harm reduction has very, very queer roots, and just embracing people for where they are in their journey and for who they are and what they're doing. And, how can we do this as safely as possible, right? How can we prevent the spread of HIV without giving up the things we enjoy, and whether that's sex or drugs or whatever our vices are. Our goal is not to just convince people to completely change their lives overnight. It's to say, okay, well, what small changes can we make here? If people are engaged in our medical case management services within our HIV program, and we know that they are living with other folks in community who may or may not be HIV positive, they will get extra syringes. Folks in our program will always get extra syringes, anywhere from 50 to 200, depending on their situation.
Okay, well, thank you so much, Tiff. Our time is unfortunately up. I could talk for hours with you, and we'll do that in the future in person. Thank you so much for your time. Thank you.
Y'all have a great one. Thank you so much for having me.
Sure, yeah, thank you. All right, that was a lot today. We at QT know that experiences as marginalized communities can have a direct impact on health and well-being. We also acknowledge that because of intersecting identities and overall homophobia and racism in the world, the struggle may be harder for some people than for others. This is why it is even more important for us to acknowledge our privilege and to stand up for our LGBTQIA+ siblings, our chosen families, and our dear friends. Please take care of each other, be aware of each other, and never forget to love each other. Until next time, share some love with the people around you and make this world a better place. I'm out and proud, signing off. See you soon. And now, the weather. Welcome back welcome back also QT Queer Temple. I think that's all I'm doing, right? Shout out, this is from Wear a Mask. Oh, this is amazing. I love this. Welcome to the Travel Channel. What you can see behind me is the city of Philadelphia. You see the skyline. That's Dr. Evil. What if I'm just gonna stand in a really awkward position, just like that the entire time? Safety first. Hi, my name is Gloria Estefan, and today we're gonna do gymnastics. Cut, done. Thank you, no. We'll see you soon.